everybody, and welcome to another episode of Fun Facts at the Pharmacy. I am your host, Dr. Christopher Greider. For anybody tuning into the show for the first time, the purpose of this show is to kind of give you some general basic health information so that you can make better decisions, and then kind of talk about some health-based topics that might be very broad and impact a lot of people in the general world. Starting off with the first part of it, our initial segment here is the fast-acting portion. We normally try to talk about something that's up-to-date, current, or going on in the world right now with health. One of the big things that's been coming up, and of course, if you've watched any of the previous episodes, we are still currently dealing with COVID, of course. The vaccines, they have been updated so that there is a bivalent vaccine that's available now. That bivalent vaccine covers a lot of the newer strains, so like the Omicron strain and all of the previous stuff. So the recommendation is if it's been at least 2 months since you got your last booster completed, they would recommend getting this shot done. It seems as though they are shifting to, hopefully, if things go well over during like the fall and winter times, they're hoping to kind of make it more like a yearly vaccine, similar to like a flu vaccine from the sounds of it. Now, the one thing to kind of keep in mind is that at the time of this recording, leading into the beginning first quarter of January of 2023, right now the vaccines are completely covered for any patient, whether you have insurance or you're uninsured. The hard part right now is that things are starting to shift, that if the funding isn't kept with the government right now, they are going to shift it to more privatized, which means that the COVID vaccines would only be available for people with insurance. If not, you would have to pay out of pocket for it. The price, I could not tell you because it's going to probably vary depending on what the drug companies do between Pfizer and Moderna. But the main thing behind them right now is that it's best to get it done sooner than later. If you haven't had a vaccine and you changed your mind and you want to get it done, they would recommend setting that up just because we want to kind of get you vaccinated as quickly as possible. With fall and winter times, most of the time with major diseases like flu, for example, COVID, even things like pneumonia, we always have to be very careful. So they always recommend getting your vaccines done before going into those seasons. The reason being is you're going to be in a lot of closer quarters with people, so you're more likely to come across things that could be potentially bad for you. So taking a look at it right now, our main segment today, we're going to be focusing on something called anxiety. As most of you have heard the word, it's something that it impacts quite a few Americans throughout the world, and I'm sure with the COVID pandemic and other things going on, it's actually made anxiety worse for a lot of people. So the main thing with that is we figured it would be best to kind of talk about it a bit just so that you understand like what is anxiety, how do we go about taking care of it, and maybe what are some things that you could potentially do at home that could help with it if you do suffer from it. So to help kind of talk about that today, I do have with me a fourth-year pharmacy student. His name is Manny. He's actually currently with me at Mark's right now on rotation for school, but I have him here today to kind of talk to you a little bit more.
Hello there. My name is Manny, and again, Chris said I'm a fourth-year student at NEOMED. My biggest interests are currently psychiatry pharmacy and oncology pharmacy, so since I really like psychiatry pharmacy, I'm here to talk about anxiety with
Perfect.
you all.
Yeah. So kind of talking about it, what is like, how would somebody go and define like what anxiety is? Like what is it when we boil it down?
So just looking at the bare basic definition of anxiety, just going by the dictionary, like the Webster Dictionary defines it as a feeling of worry, nervousness, or unease about an imminent event or something with an uncertain outcome. So anxiety in and of itself is a natural emotion that everyone's going to feel at certain points in their life, and it only becomes an issue when it significantly impacts your ability to live life and feel other emotions and function how you desire to function.
Gotcha. So kind of looking at it right now, I mean, one of the things that we are like, one of the ways that we help to differentiate, say, anxiety from other serious issues is like some of the signs and symptoms. So when we're looking at it, like how would somebody know if they're having anxiety then?
So it depends on the type of anxiety that they're having. Two common diagnoses that have to do with anxiety include panic disorder or panic attacks, and then there's GAD, which is generalized anxiety disorder, and they are both distinct. So when it comes to panic attacks, that's going to be more of repeating episodic forms of anxiety that happen suddenly and then also go away within a specific amount of time after it sets in. So symptoms of panic are going to be both mental and physical. So when I say physical symptoms, I mean more of like your heart beating really fast, or maybe beating irregularly, like how you're used to it beating. You might sweat, you might start shaking and trembling. You might feel like you're being smothered or choked, there's heaviness in your chest. But then on top of that, you're also going to be feeling a lot of worry, fear of maybe dying or the upcoming event, maybe embarrassment, and it's just going to be an overwhelming amount of fear that takes over any other thoughts or concerns you might have in that moment.
Yeah, so kind of thinking of it in that regards, it'd be similar to like if you were like, say, doing a presentation, or if you were, expecting a baby or something unusual like that, then you may experience more of like a panic type style.
Or like the COVID shots you were talking about before. I know some people just are really afraid of needles, so going into the pharmacy to go get your yearly immunizations might be an event that triggers a panic. But if you're just nervous about it, then it will be transient, like it'll go away. It won't like impact your ability to go to the pharmacy and get the shot. It might not be fun to do that, but it won't impede that. Now, if you're having a panic attack, you're going to be feeling so many physical symptoms and mental symptoms that it might stop you from even getting that vaccine in the first place.
Fair enough. So kind of looking at generalized anxiety disorder, so what would help separate that from, say, a regular just panic situation?
So generalized anxiety disorder is going to be a more constant state of anxiety. It still varies from hour to hour and what's going on in life, but there's always this base level of anxiety that's being felt. So you're going to have excessive worry about all kinds of different factors, your health, your relationships, your work, and that's just going to be happening throughout the day in various degrees. And otherwise it manifests in different ways. You could be really restless and really irritable because you have so many things to worry about, or you could be fatigued and just tired and drowsy all the time because you're so tired of having to deal with the mental stress of having all of this worry on you at all times. And that can affect your concentration, it can affect your sleep, it can cause you to be tense all the time. And then on top of that, you may still have panic in some moments as well.
Okay. So it seems like it's that constant, like if you just feel like you're always kind of like in a state of anxiety, it feels like that would be more of like your generalized then. Okay. So kind of taking a look at it, because we did cover like, the panic symptoms and generalized anxiety. One of the things that we noticed is that there's different ways that they kind of diagnose it. So there's different names amongst all the different types of potential anxiety. So we covered the generalized anxiety, we covered like the panic, but is there anything else that you can think of that would fall into that category?
So there are some other subcategories of anxiety disorders. There are some that are pretty obscure, but maybe a couple that you might know about would be OCD or obsessive compulsive disorder. So that's going to be like anxiety associated with not doing certain activities or routines that you have in your life. So if you don't do this certain thing in the morning, then it's going to bring about feelings of panic. And then there are other situations too, like social phobia, where you have anxiety, but only in social situations, and other phobias that have to deal with fears may be classified under anxiety, but then they might also be different diagnoses in and of themselves. The DSM-5, the book that has all the diagnostic criteria for mental disorders, it can be quite complex sometimes.
Yes, and I'm glad you mentioned that, because that is typically what they'll normally use, especially most of your doctors. And if you see, like, say, a therapist, a psychiatrist, anything like that, there's no harm, no shame in it, but they normally use, there is like a giant compendium that just has every major mental disorder in there with a little bit of like how we figure that out. So it's nice to have that just as kind of like a reference guide there. So
On top of that, though, it is important to the individual that's experiencing anxiety, because their anxiety is going to be their anxiety. It's an individualistic disorder, as is many mental disorders. So some symptoms might be present, some may not be present, and the patient may feel very connected to their disorder. So
yes, yeah, it's kind compared to most other treatments where you get kind of like a general guideline about everything, mental disorder in general is, like you said, it's very individualized, which is very good to remember, that not every one person is a cookie cutter image of what they would describe. So
exactly.
Yeah, it's one thing that I always stress to patients and just to the general public is like, just because you may be experiencing certain signs or symptoms does not mean that every person will experience the same thing. So it's good to make sure you talk to somebody about that. So yeah. So kind of helping to separate it out. So anxiety, like, I'll be honest with you, there are constant, drug commercials and stuff that are like, oh, do you suffer from anxiety? Do you suffer from depression? But to be perfectly honest, anxiety and depression aren't always the same. So
absolutely not.
One of the things that I would be curious about is, like, is there a way to kind of like differentiate, say, anxiety from a depression or other mental diseases that are out there?
Yeah, so anxiety actually is a common disorder that is comorbid with other disorders. So you might have anxiety, but then also have other disorders. So one of the most common combinations are major depressive disorder and some kind of anxiety disorder. And when it comes to major depressive disorder versus the anxiety, major depressive disorder, or just depression as you may know it, will be more of low mood and feelings of worthlessness, low self-esteem, lack of energy, lethargy, lack of interest in daily activities. If you just have an anxiety disorder, then you may still be able to be interested in things that you like, may still have the energy to go and pursue relationships and such. But with depression, it's going to be a more internalized self-image and lack of motivation, etc.
Gotcha. Okay. So kind of looking at it right now, like I said, there's advertisements up the wazoo for every known treatment on the planet for, anxiety, for depression.
Yeah.
And they always try to relate it with like other issues. So kind of taking a look at it, like, so therapy-wise, when we're talking like medications, what are some things that somebody could potentially be on that would help them out with anxiety?
Well, we finally got here because we're the pharmacists, so.
Exactly.
Well, I'm sure that when most people think of anxiety and medications, the first thing that comes to mind is benzodiazepines. A lot of the time it's Xanax, because not only is it a very widely prescribed medication, but unfortunately it is commonly abused in pop culture. I've heard plenty of rap songs that include pop and Xannies. So, but other names that you might recognize are Ativan, which is lorazepam. Again, Xanax is, the generic name is alprazolam, and then maybe Klonopin, clonazepam. A lot of them end in pam. But so these medications, how they work is they work on a type of molecule that's a neurotransmitter. And neurotransmitters are molecules that work inside your nervous system that transmit different signals that have different effects depending on what the molecule is. And in this case, it works on one called GABA. And GABA is one that kind of slows your brain down. It makes it not work as heavily. Interestingly enough, this molecule has a major effect when you're having an alcoholic drink. So if you're having a beer and you start to feel a little tipsy, generally that's going to be the effect of it having, or has an effect on the GABA in your body. So with benzodiazepines, they affect the receptor that GABA binds to, but not in the same way that GABA binds to that receptor. They go to a different area on it. But that being said, when they bind to it, they activate it, your brain starts to slow down, and when you have anxiety and your brain is kind of going really fast, being worrisome, thinking about whatever this event or situation is that is causing you distress, allows you to not have as many feelings of distress and maybe be able to move away from that thought.
Gotcha. So it kind of helps to like slow things down is kind of the best way to think of it.
Mm-hmm.
So, yep.
That being said, though, it's not without its limitations and side effects. And the biggest side effect that I see a lot of people have with benzodiazepines is sedation. If you take too many of the pills, or you take too high of a dosage, which you might not even know right off the bat, you could pass out. You might just feel really, really tired, end up on the couch all day. Maybe you're not going to get too much like actually restful sleep, but you'll just be really, really fatigued. And another common side effect with them is amnesia. So if you have too high of a dosage, then you may not remember things as well while you're taking it. On top of this, if you take benzodiazepines for a long amount of time and you take them regularly and then you stop them, it can cause a withdrawal. And these withdrawals are not just like you're sweating a little bit for a couple of days. It can get dangerous. You can have seizures, and this might require you to go to rehab if you've been taking a large amount of them for a long amount of time.
Yeah, so you bring up a really good point. So one of the things that I always tell people is, if you feel uncomfortable with taking the medication, if it's something that you started, especially with any of the benzos, it is one of those things that if it's an initial dose and we're like, you don't feel comfortable with it, we can normally pull it off and you're normally going to be okay. You're not going to experience those withdrawal symptoms. Mm-hmm. But like you said, I've had patients that have been on it for, 15, 20 years, for a long time on this set dose, that it is typically a weaning process. Like, it's not something that just happens overnight. So it is a good thing to double check and especially talk to your physicians about if it's something that you're uncomfortable with, or whoever had prescribed it for you in the first place.
Absolutely.
And the other big thing that I always like to stress to people too is just interactions, because you brought up a very good point too of the slowing down on your breathing. One of the big ones is, pain medications, for example.
Yes,
we have to be
opioids.
very careful whenever you're on anything that's classified as an opioid.
Yes, a large amount of overdosing deaths in the last few years has been due to combinations of benzodiazepines and opioids. So if you're on a pain medication, or if you are addicted to a medication or a substance that is opioid type and you take a benzodiazepine, they can have really deadly side effects that prevent you from breathing and can ultimately cause death.
Yeah, so not to scare anybody away from it, because it's not anything that's going to be necessarily common, but like you said, in high doses we have to be very cautious with that. So and that's kind of where we step in to make sure that we're not hitting those high peaks if we can avoid it as much as possible. So perfect. One of the big issues that we have with the benzos also is in some of our older patients. Can you talk about that a little bit?
Oh yes, in older patients, since it's so sedating, it might allow them to, or not allow them to walk correctly. They might stumble a little bit. And if you're a very elderly person with brittle bones and such, if you fall, it can just absolutely shatter those bones. So we want to take every precaution necessary to make sure that falls don't happen in the elderly. And since benzodiazepines can make you so sedated, if you try and walk while you're that sedated, that sleepy, there's more of a chance that you could fall and get very seriously hurt. But that being said, some people that are elderly may have been on a benzodiazepine for a long amount of time. And like we were talking about with the withdrawal symptoms and how serious they can be, sometimes it might just be better to keep them on the dose that they've been on. So it's really a case-by-case basis.
Gotcha. Yeah. So looking at it right now, kind of shifting away. So what is typically like the first line of therapy? So like we know that a lot of people talk about benzos, but what's something else that people could use that could potentially help?
Yeah, so benzos aren't the first line agent at all. They're not going to be the first thing you're prescribed for anxiety because of their abuse potential and their side effects and such. They're more of used as a second line to help with panic attacks and such, depending on when they kick in, or for people that haven't tried the first line. And the first line therapy that is going to be given to a patient first is going to be a selective serotonin reuptake inhibitor, which is an SSRI.
Okay. Yeah, could you tell us a little bit more about those then?
So they're pretty widely prescribed medications. They're used for several different disorders. A major one is major depressive disorder. So if you have depression and you have anxiety, it kind of hits two birds with one stone. And some names that might sound familiar are Prozac, that's generic name is fluoxetine, Zoloft, generic name sertraline, Lexapro, generic name escitalopram. We fill a lot of those.
Yes.
So these ones work by a different molecular mechanism. So instead of GABA, which was the main neurotransmitter for the benzodiazepines, this one's going to work more on serotonin, which is one of the monoamines. It's a very common neurotransmitter to talk about, and it's very indicated with mood as the science is right now. So it allows your neurons to have a bit more serotonin when they're interacting with each other rather than getting rid of it.
Gotcha. Okay. So with that being the case, like you said, there's a handful of them out there. What would be some potential things that people should look out for if they are put on these medicines?
So a big issue that I see with people starting SSRIs is, interestingly enough, sometimes they might end up having worse anxiety when you start it, but that's a temporary side effect. It really is not fun to go through, but after the first maybe maximum week, then it starts to go away and your anxiety will then go down as intended. But sometimes there might be an increase in anxiety in that short period beforehand. Same with gastrointestinal problems. It might cause you to have some abdominal cramps. It can cause some nausea, maybe diarrhea. And that's uncomfortable, but it usually goes away within the first week or two after starting the medication. And it can definitely be made not as intense if you start on a very low dose and then raise it up from there. Besides that, another one that I've seen that a lot of people have concern with is it has effects on libido and sexual activity. And that can be pretty serious for some people. So some can't go on the SSRIs because they've tried it before and now their love life is affected, and it can be pretty distressing.
Yeah, and I always say it's one of the side effects that's always hard because most people feel uncomfortable mentioning it or talking about it. Mm-hmm. So yeah, it's understandable.
With these psychiatry medications, it's very important to be as clear as possible with your doctor and pharmacist or other healthcare professionals about your symptoms. It's not embarrassing, it's necessary information to make sure that you're on the best medication possible and able to live your life in the best way.
Yeah. So looking at it right now, there are a few other medications that can be used to kind of help out. They're not used in the same manner. Like you said, the last couple of medication classes that we've talked about have been more focused on like the chemical aspect. Mm-hmm. But I know that there's some medications that they can use that help more like physically, because like you had mentioned at the beginning, one of the hardest things with anxiety is that sometimes it's a physical trigger too that can really like get in there.
Yes.
So can you mention just a few of those medicines real quick?
Yeah, so with the benzodiazepines and the SSRIs, I mentioned neurotransmitters and their mechanisms, and that is going to be more of an effect on your mental state and your mind and your thoughts, whereas you still can have those heart palpitations, the nausea, the sweating and such, the shakiness. So one thing that may be prescribed for those kinds of situations or to help with those symptoms may be hydroxyzine. That one works on histamine receptors. It's an antihistamine, kind of like the allergy medications that you might be familiar with, like Zyrtec and such, but this one's a little bit different. And so it's going to relax your muscles. It might help you feel less nauseous. It might even help with pain sometimes. And it's short acting, comes on and then comes off.
Yeah, and the one thing that I always like to stress about hydroxyzine is that there's, like you said, because of the way it works on your body, there's so many different uses for it that somebody that is prescribed hydroxyzine, there's different forms of it that exist that I always tell people, just because you're given it does not mean it's used for anxiety exactly.
Yes.
Like you said, it works very similarly to other allergy medicines. So people in severe cases of like either like allergic reactions or say like you came across like some unusual itching, because I know some people feel like they have something underneath their skin where it feels like there's something crawling on them. They could be prescribed something like hydroxyzine as well, because like I said, there's two different forms that exist of it. So I want the general public to understand, like, not to panic. That's not what we're saying, that you have anxiety. It could be for other things too. So, yep.
So propranolol is a beta blocker, which is a common type of medication that will be prescribed for things like high blood pressure, heart failure, and such. But in this case, it's being used to slow heart rate during a panic attack, and lower blood pressure during a panic attack, because that might be raised too. So this is, again, more of a medication that'll come on pretty quickly and then go off pretty quickly.
Gotcha. So we're kind of slowing things down, but more from the physical side rather than in your head. So.
Exactly.
Yeah. So we've talked a little bit about medicines. Like I said, if we kept going with this, these segments could take a couple hours to get through, because I know that's well, I mean, we go through pharmacy school for it for a reason. So kind of looking at it right now, if somebody didn't feel comfortable with doing medications, or if they wanted something else like on top of what they're currently taking that maybe doesn't involve medications, what are some things that they could do at home or do for themselves that might help with their anxiety?
Well, first things first, I'm a firm believer that medication should be always coupled with some kind of therapy. So having a good therapist and regularly seeing them can definitely have a big effect on your anxiety and any other mental disorders that might be going on. But something that you'll be taught in therapy will be things called grounding methods. And that is a way to center your mind and move away from the thoughts that might be causing you anxiety. So if you'd like, we could try one of those right now.
Sure, let's go for it.
So a common one is just taking multiple deep breaths, but we're just going to do one. So we're going to take a slow, deep breath for 5 seconds, and then a slow, deep exhale for 5 seconds.
Okay.
So I'll just count with my fingers. So you do that a few times. Although it's a physical effect, it really has some effect on both your physical symptoms and your mental symptoms. And it's a common first step in learning grounding methods. Other people may use objects that feel nice on their fingers, like fidget toys, and even something that might be relevant in pop culture because, the show Better Call Saul, that's popular right now. There's a character in that has a mental disorder, and he uses a grounding method where when he goes into a stressful situation, he'll name objects and the colors of the objects in the room to move away from his anxious thoughts. So like there's a silver beam over there, or a black camera, or beige table.
Beige table, yeah.
Yeah, just like focusing on those physical things around you rather than the anxious thoughts you might be having can change how you're feeling and what you're thinking.
Perfect. So they're kind of like methods to either like physically help slow things down a bit so that you're kind of more at ease, or like you said, like with the naming of objects and stuff, it kind of like provides that distraction so that maybe like whatever's on your mind isn't the primary focus anymore to help slow things down. Perfect. Well, thank you so much for coming on here today.
Glad I could be here.
Yeah, I appreciate it because it's nice to get some general information about it, and especially like you said, like some of those techniques are really good to incorporate for some people that maybe would help them potentially in their future. So that ends our segment today. The main thing with it for you is I always like to say at the end of these, especially with mental health, never be afraid to talk to somebody about it. Especially healthcare providers. I mean, there's therapists, there's psychiatrists. Never feel like you're in a corner by yourself most of the time, because the hardest thing is that there's no cookie cutter version for mental health. Everyone is different. Everyone has different symptoms, issues. So talking to your doctors, your nurses, your pharmacists, your healthcare providers about things that you could potentially do, or what you would need to do to get help is never a terrible thing. If you ever have any questions about any of the things that we talk about on our show, once again, talk to your doctors, talk to your healthcare providers. We're here as a primary resource for you because we want to make sure that you're getting the best help you can. But besides that, thank you so much for tuning in today. If you need to, we hope that you check out further segments so that way you can kind of get more information about your general health. Have a good one.